Have you ever been driving along and nodding off? Maybe you feel really tired during the day, but you haven't done anything strenuous, and you had a good night's sleep, or so you thought. This is because sleep apnea disrupts sleep quality, leading to daytime sleepiness. This is due to the disruption in sleep quality caused by the condition. This is because the episodes of sleep apnea can cause fragmented sleep. Now, obviously, that isn't ideal. It can be quite a serious sleep disorder and can cause some massive issues if left untreated. So excessive daytime sleepiness, loud snoring, observed breathing pauses, waking up a lot, gasping, snorting, or choking sounds, morning headaches, and difficulty concentrating. The condition causes sleep deprivation, which can affect mood and emotional well-being. So sleep apnea, what does it mean? It's not ideal. There are many types of sleep apnea, right? Stroke metabolic problems, excessive daytime sleepiness, mood swings, irritability, and increased risk of accidents. So you're sleeping away, and then your breathing stops, and instead of oxygen going into your lungs, you're actually just taking in gulps of air. Sleep apnea is a condition where breathing repeatedly stops and starts during sleep. If you find yourself becoming easily irritated or experiencing mood swings, it could be related to sleep apnea. Well, it could be that you are suffering from sleep apnea and not even know it. During an episode of sleep apnea, the breathing repeatedly stops and starts. If you think you might have sleep apnea, it can be helpful to ask someone to stay with you while you sleep, so they can check for the symptoms. This can be observed by a bed partner or recorded using wearable devices. A common test used to diagnose sleep apnea is a sleep study. This helps to identify the type and severity of sleep apnea, allowing for appropriate treatment. For example, obstructive sleep apnea is often treated with a CPAP machine, which provides continuous positive airway pressure to keep the airways open during sleep. During a sleep study, you'll be monitored for breathing, heart rate, and other vital signs while you sleep. It's important to note that sleep apnea can have serious consequences if left untreated. We're going to cover all of those things and much more today, so let's get into it. Now let's take a look at the risk factors. So who's at risk of sleep apnea? It can affect anyone, but certain factors can increase your risk. Smoking and alcohol consumption can also increase the risk of sleep apnea. Having a large neck circumference can be an indicator of increased risk. Most common form of sleep apnea: excessive daytime sleepiness. If you feel excessively sleepy or fatigued during the day despite getting a full night's sleep, it could be a sign of sleep apnea. Gasping or choking sounds. Hearing or making gasping or choking sounds during sleep can be a sign of obstructive sleep apnea. Difficulty paying attention during the day. Having trouble concentrating or paying attention during the day can be a symptom of sleep apnea. Irritability. Now, as I said, there are different types of sleep apnea. So let's explore the two main types. Diagnosing the specific type of sleep apnea is crucial for effective management. So as we said earlier, obstructive sleep apnea is the most. Central sleep apnea is less common and occurs when the brain doesn't send the proper signals to the muscles that control breathing. This can result in pauses in breathing that last longer than those seen in obstructive sleep apnea. Both types can cause daytime sleepiness and other disruptive symptoms, but they require different treatment approaches. Obstructive sleep apnea is the most common form and occurs when the throat muscles relax and the airway narrows or closes during sleep. So obstructive sleep apnea occurs when the airway becomes blocked or narrowed by overly relaxed airway muscles or by enlarged tonsils or other obstructions. However, there are certain symptoms that are more common in each type, and we'll cover both of these today. It occurs when the muscles in the throat relax and the airway becomes blocked or narrowed during sleep. The most common symptoms of obstructive and central sleep apnea are as follows. If you snore loudly and frequently, it could be an indication of obstructive sleep apnea. Breathing repeatedly stops and starts during sleep. Therefore, it's essential to seek medical attention and follow the recommended treatment plan to manage sleep apnea effectively. Who gets sleep apnea? Well, several factors can increase the risk of developing sleep apnea, including being male, being overweight, smoking, use of alcohol, having a large neck, a narrowed airway, older age, family history. Smoking damages the tissues in the upper airways and increases inflammation. while alcohol relaxes the airway muscles, leading to airway collapse. Being overweight or obese increases the risk of sleep apnea. A larger neck circumference may suggest that the airway is more narrow, making it more likely that the airways will become blocked during sleep. Excess weight around the neck and in the upper body can contribute to airway obstruction. Experiencing a sore throat or dry mouth in the morning could indicate that you were breathing through your mouth during sleep, which is common in obstructive sleep apnea. These factors can contribute to the development of sleep apnea by affecting the structure or function, or both, of the upper airways, or by altering the signals that control breathing during sleep. The brain detects the lack of airflow and sends signals to the body to briefly wake up and start breathing again. Now let us take a look at the treatment for sleep apnea, because it is important, as untreated sleep apnea can lead to heart and blood vessels problems. Treatment for sleep apnea depends on the underlying cause and severity of the condition. Fortunately, there are effective treatments available. One of the most common treatments for sleep apnea is a CPAP machine, also known as continuous positive airway pressure. Make sure that the machine is within reach in case you need to adjust the settings during the night. Benefits of using a CPAP machine: there are lots. CPAP machines are considered the gold standard treatment for sleep apnea, and for good reason. They have lots of benefits. Here are some things to remember when using a CPAP machine. Using a CPAP machine may feel strange or awkward at first, but try to keep using it. It works best if you use it every night. How a CPAP machine treats sleep apnea? As I said, it's simple really. This device delivers a constant flow of air through a mask worn during sleep, which helps to keep the airways open and prevent them from collapsing. Instead of letting your breathing stop and start, the CPAP machine keeps a steady flow of air into your upper airways, helping to keep them open and stop them from narrowing too much. It helps to keep your airways open and prevents them from closing so that you can breathe more easily. These are often used for people with mild to moderate sleep apnea. This includes connecting the air tubing, water container, and mask. It gently pumps air into a mask you wear over your mouth or nose while you sleep. They help you breathe better whilst you're sleeping, meaning that you'll get a higher quality of sleep. This means that you won't stop breathing or struggle for air while you sleep. Make sure that everything is properly fitted and secure. Next, you'll need to adjust the mask to ensure a comfortable seal. They come with various settings that can be adjusted by the user or with the help of a healthcare professional to ensure optimal comfort and effectiveness. Ensure a proper fit. Make sure that the mask fits well to prevent leaks and discomfort. Make sure that it fits snugly but not too tightly. Start with a lower pressure setting and gradually increase as needed. It may take time to adjust to using the CPAP machine, but it's important to continue using it as prescribed by your doctor. Keep the equipment clean. Follow the manufacturer's instructions for cleaning and disinfecting the mask and tubing. Be patient and persistent. Follow the manufacturer's instructions for putting on and adjusting the mask. Finally, turn on the CPAP machine and start treatment. Tell your doctor if you find it uncomfortable or hard to use. This will leave you feeling more refreshed and energized during the day. Using a CPAP machine can also reduce the risk of accidents during the day due to excessive daytime sleepiness. Improved sleep quality, reduced daytime sleepiness, lower risk of accidents, better overall health. By improving your sleep quality, a CPAP machine can also help with other conditions that may be related to sleep apnea, such as high blood pressure and heart disease. CPAP machines are often the first line of treatment for sleep apnea and are considered highly effective. In UK, you'll be given this for free on the NHS if you need it. Surgery is another option for some individuals with sleep apnea, and it can help to remove any obstructions in the airways. This may include removing enlarged tonsils or adenoids. Lifestyle changes such as weight loss and avoiding alcohol or smoking can also be recommended to help improve sleep apnea symptoms. A gum shield-like device that holds your airways open while you sleep. I hope you found that useful.